From BrainCheck.
Hey, thanks, Bill, for inviting me out here and giving me the opportunity to speak on such an important issue that's affecting so many people. So I'm Mike Grace, and I'm with BrainCheck. BrainCheck's a mobile technology platform providing rapid measurement of cognitive health that is based on scientifically validated methods. We're out of the Texas Medical Center. It's one of the largest medical centers in the U.S., and BrainCheck was actually born out of Baylor College of Medicine in Dr. David Eagleman's lab. So most of us will encounter a cognitive health issue at some point in our lives, whether it's concussion during a game, in the course of training, while on TDY or downrange. It could be dementia as we age, or it could be a temporary impairment from lack of sleep, alcohol or a drug or a medication that makes us unfit for duty and prone to accidents. Concussions all over the news lately, and has been a subject of discussion at the dinner table for many families. A major problem with concussions, or TBI, is that it's not caught early, and someone gets injured again, it can cause permanent brain damage, in some cases even death. Apart from high-impact sports, recent wars have brought the TBI problem to an epidemic proportions, leading to nationwide mandates and protocols for sports in the military. It doesn't take a neuroscientist to tell us that mental fatigue due to any source, long hours, high-stress situations, heat exhaustion, of course, drugs or alcohol, make us prone to accidents. Accidents are a huge problem because they not only carry a human cost, but also a financial cost and are a major factor in affecting troop readiness. So tracking cognitive health is as important as tracking physical health. BrainCheck's a mobile, easy-to-use platform that can be used by anyone, anytime, anywhere. Our tests are modular, and we have products that can help you track and monitor your cognitive functions that may be affected by concussions or mental fatigue. BrainCheck's state of the science. We use gold standard tests, the same kind of tests that you would use while at a neurologist's office. So we've taken these well-established neurocognitive tests to the Eagleman Neuroscience Lab at Baylor and developed them into interactive games that people find fun. So whether you're on the sidelines of a game, on TDY, an emergency room, or downrange, BrainCheck's easily deployed to an individual or across an entire organization. And one of our major objectives while developing this platform was to make it easy enough for anyone to use and to provide time-stamped objective results that take away the emotion and uncertainty out of situations and provide you with the information and confidence that you would need. So we have a couple of examples of some of the tests that we use. I can go over a few of them briefly. This is called the flanker test. Here we present the user with a target arrow, and it's pointed either to the left or to the right. The target arrow is usually surrounded by either congruent or incongruent arrows, and we ask the user to identify which direction the center arrow is pointing as quickly and accurately as possible. This is our digit symbol substitution test. This is a continuous performance test in which the participant is asked to match the symbol to the number as many times as possible in a 2-minute period. And this test measures general cognitive performance. This is called the Stroop test. Here we introduce competing pieces of information and measure the reaction time required for a person to overcome cognitive interference. This is the trail making test. Here the user is asked to tap a series of dots in their correct order as quickly as possible. There's also a more difficult version where they're asked to tap on dots alternating from numbers to letters. This test measures visual search speed, scanning, visual processing, mental flexibility, and executive functioning. Here we have the memory span test, and this is actually a graphical version of the digit span test. And it's modeled after the game Simon, and it tests working memory. So when an individual suffers concussion or a head injury, there are specific changes to their working memory, visual processing, cognitive processing, executive function, and so on. So we're able to measure these functions in about 5 to 7 minutes and quickly identify changes to a person's norm by comparing their results to their baseline results or to a population database. We're also able to have several different ways to break down the information to a user and can customize outputs based on the organization's needs. So we're in multiple schools in the Houston area, both public and private, and we're actually growing rapidly in that area and have been receiving great praise from the athletic trainers, so that's really encouraging for us. We're also collaborating with several hospital systems to become a first-line tool in the ER room, so we'll reduce costs and improve outcomes. We're working with clinics to provide a unique continuance of care between the sidelines and the neurologist. We're also in several community centers and memory clinics, and are working with several companies in the oil and gas sector to integrate BrainCheck into their safety programs. And obviously we're here today to introduce our platform to the military and have a discussion about how we can assist in the optimization of human performance. So all the data that we collect is stored on our HIPAA-compliant servers, and one of our long-term goals is aimed at advancing the science of cognitive health, which would be leading to new products and outcomes that would help people. So our management team is internationally recognized. Our founder and chief scientific officer, Dr. David Eagleman, among other things, is the best-selling New York Times author and has been studying the brain for over 20 years. His work has gained him a viewership of over 2 million viewers worldwide, and that number will probably surely continue to grow with his new launch of the PBS series titled The Brain, which actually is airing tomorrow, and I would encourage you guys to check it out. Our CEO, Dr. Yael Katz, holds a PhD in neuroscience and has extensive experience combining neuroscience with big data. She's also done consulting for the healthcare industry and is a veteran of the tech industry in New York. This is some of the rest of our team. We have deep experience in product engineering, marketing and e-commerce, research and clinical, and of course, business development and sales. And lastly, one of the things that we're doing right now is raising money to bring BrainCheck to underserved schools so they too can have access to our platform. So I would ask that everybody here, please go check out our website and take a look at the Kickstarter video that we have and to learn more about this program. With that, I also have a couple of tablets here if anybody's interested in taking some of our tests, and I have some additional brochures with information. And that's it. If there's any questions, I'd be happy to answer them.
Hi, Kevin Mangum again from Training and Doctrine Command. So you talked about doing this test longitudinally over time to determine brain damage kind of pieces. What about emotional or being able to measure stress and emotional reaction to that over time?
Right. So what we're really doing is we baseline people, and if they suffer head injury or they're working long hours, we go ahead and we would test them again and they compare those kind of results. So as far as emotion, it's really just the general domains of equilibrium, working memory, visual processing, cognitive processing, those kinds of things. So not really emotions here.
Any other questions? Okay.